Is your doctor an idiopath? What does that mean? Well, if you're suffering with a chronic illness, it's not uncommon to have gone through the ringer and received all the medications or treatments that they have for it and felt no better. And when you get to that point, the doctors throw up their hands and say, we don't know, it's idiopathic. And what idiopathic means is an unknown cause of a disease. Well, let's dive into what else that idiopathic label could mean. I'm Dr. John Bartemus, and I'm putting the pieces together to help you live a life at optimal. Dictionary.com defines idiopathic as an unknown cause of a disease. If you see the word idiopath, idio would be the root that is also shares commonality with the word idiot or idiotic. And dictionary.com says idiotic is defined as senseless and having no meaning. And a former use of the word idiotic that we're all familiar with, or idiot, stems from the meaning of less than mental retardation or having a low IQ. So if we put these two things together, a synonym for idiopathic on dictionary.com is elementary. So we could translate this as, if your doctor says, hey, we don't know, it's idiopathic, that's an elementary diagnosis or a lack of thinking or a senseless diagnosis. And so if your doctor is an idiopath, they're basically exhibiting a lazy tendency. They're saying, well, we've tried everything we know how to try, and I don't want to look further, or I don't have the time to look further, or we're not going to look further into what's actually causing your specific illness. So it's idiopathic, and see you later. And this can be very frustrating as a patient because you want to get better, you want to know what's going on, and it's not helpful if someone says, well, we don't know what causes it, but good luck. So I had a consultation recently with someone who's been suffering with just this. This person is an avid triathlete, and when they train, specifically the running portion, for more than 90 minutes, they develop post-exercise hypotension, meaning their blood pressure drops through the floor and their heart rate skyrockets, and they have to lay down to prevent fainting. Well, nobody can figure out what's going on. The conventional medicine has called it idiopathic post-exercise hypotension. They've been to a cardiologist, every EKG, echo, stress test, everything's been clean and clear, so they're saying it's not your heart. Well, okay, great. We've tested the fact that it's not the heart. Well, the rest of this person's body has not been tested or investigated. So they've called this idiopathic, but really that's just an idiotic diagnosis because they haven't exhausted their resources in trying to find out the cause of this illness for this person. So should this person just continue to suffer because no one's going to look further for them? No, what healthcare should do is dive in and do the dirty work, do the detective work to look deeper and find the cause. Don't be an idiopath, be a detective that you're supposed to be as a clinician to find out what is the cause or root causes for this person. So in just a 20-minute consultation with this person, getting more in-depth history about them, I've got 3 or 4 hypotheses as to what could be driving this, and therefore 3 or 4 areas to investigate further to go find, hey, how many or are any of these contributing to the case? And then history and medical record review will help guide us as to other rabbit holes to go down. So if you're suffering from a chronic illness or chronic disease and you've been given the idiopathic label, don't lose hope and say, oh, I'm just stuck with it. Know that the method or paradigm of treatment that you've used has been exhausted and they're not going to go any further for you. But it doesn't mean you're stuck with that. It just means you need to find someone who's got a higher investigative IQ, we'll say, and who's willing to do the detective work to find out your specific cause or causes to your chronic illness. And when you can find those, you can address those and then return to a life at optimal.